Welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Today on the program, we're taking a broad look into drug dispensing while exploring the significant role it plays in the healthcare system. I have joining me virtually to explore perspectives on the subject, pharmacist Adamu Umar Eshimotu, who is the chairman, Pharmaceutical Society of Nigeria, KEBI, and also the Assistant Director of Pharmaceutical Services, Federal Medical Center, Birnin, KEBI. Welcome on the program. We know that drug dispensing is just maybe when you go to the pharmacy or the chemist down the road to buy drugs, but then as a professional, I'd like for you to start off with what the definition and what it means, the entirety of drug dispensing and its role in the healthcare sector.
Yes, for layman, just like you mentioned, drug dispensing is just going to a chemist or pharmacy or super outlet. For a professional, drug dispensing is a process where the pharmacies evaluate the prescription, prepare the prescription, counsel the patient, and hand a drug to the patient. Afterward, in the process, the drug dispensing is not complete. The process is not being documented. As a pharmacist, you need to end so that if it happens, you can trace back. So a pharmacist, wherever you find this, drug dispensing is key to a pharmacist because it is dispense drugs. If he's a pharmacist, he dispenses drug to patients.
Now, very quickly, let us move on to, let's say, the importance of proper labeling and dosage and also patient education.
Yes, thank you very much. Drug dispensing, the WHO has 4 cardinal points that are involved in drug dispensing. Like I first mentioned, when the prescription comes before a physician, he has to evaluate prescription. The first thing, he has to evaluate the prescription. Know the person that wrote the prescription, know the authenticity of the prescription, the prescriber's information that the prescriber that gave it. He has to prescribe the drug. He has to sign the body of the prescription. You know that the pharmacist that this prescription is first to start with. Then he prepared the prescription, that labeling of the prescription, container to be used, the auxiliary level he needs to apply to that medication. Then he needs to counsel the patient, counsel part of the also cardinal point. That is the evaluation, the prescription, the prescription of the prescription. The counsel is also key. He needs to the patient on the use of this issue, the name of the drug, the adverse effect of the drug, what you know about the drug. You don't need to hide it. The client needs to know that these drugs, this is how it's used, this is what expected of a drug to do. So you need the patient. Then after you need to document the process. This is the 4 aspects that are dispensing the WHO that every dispenser must carry this aspect for the pharmacist. And lastly, the person, the dispenser, that is the pharmacist, need to be knowledgeable about the drug. Need to be knowledgeable about the drug, to know how this drug is being used, to know the effect of this drug, so that you counsel the patient. Sometimes counseling even involves that you need a treatment that is the person that came with the patient or the client. You need to counsel them together so that the drug is used for if an efficient, whatever we want to get, we will get it across.
Thank you so much, pharmacist. I like the fact that you've walked us through the processes of drug dispensing. Now, let me take you back to what would you say is, say, the pharmacist's role now? Let's say highlighting the crucial role of pharmacists in drug dispensing. I know you've talked about that, but then how do you ensure that the patients receive the right medications in the right doses and also with clear instructions?
Yes, the pharmacist's role in dispensing, or generally the pharmacist's role in drug, anything that has to do with drug and other things that is going to do. Like that's just like I said, because there are roles that are tangible, and the intent that is, pharmacy handles the drug to the patient. That product is tangible. It's a tangible. You see the drug, like paracetamol syrup, to the patient. You have the paracetamol syrup here. But the intangible thing, like you cannot see the cancer, but the patient cancer. The patient needs to know what is how is this drug, the level, how is this drug supposed to be used? What is the benefit of the drug to me? You need to spell out clearly in clear terms. And they could also verbal or no verbal, sometimes a level to show that this drug is used unevenly. And in pharmacy, the current practice now, the novel one, is you get somebody money, and even you it's a mutual understanding, you and the client and the patient. If you agree on the time, like if a drug in 8 o'clock in the morning and should be taking it in the evening, that is twice in a day. Don't just instruct the patient that take it 8 o'clock in the evening. No, the patient has the right to tell you that no, me, I prefer taking it in 9 o'clock in the morning and evening because it's more convenient for me. Also, some patients also even target activities. Maybe somebody go for service every day in the church. So you need to work with him. Let us link it to the periods that you will not forget. It's not even good for us to tell somebody that you cannot keep to eat. So you discuss with the patient. It's a mutual kind of interaction between the pharmacist and the so that the patient gets it right, and so that the therapeutic outcome will be okay. So that in the course of dispensing, in the course of doing drug, you have to apply what we call care. That is the responsible provision of therapy patient that will improve the quality of life patient. So the pharmacist look at it as a responsible person. You are responsible for what happened if it is not taken properly. And also there are legal implications if it is not done correctly, because it is the service that a patient demands for. If a patient knows clearly what is that, if somebody is not counseling you, it's not the other commodity that you a patient without counseling. If you don't without counseling a patient, the patient has a right to even sue you.
Okay.
Because it's a right of a patient to get counseling.
Okay, let me cut you
pharmacist.
the pharmacist.
My
next line of question is still intertwined with
to also advise the patient on how this drug should be stored.
Okay.
It's a role of a pharmacist.
Okay.
That he tells the patient that this drug need to be stored in this place.
Right.
So some drugs need their thermolava. They need to be put in the. You need to tell the patient if the drug have any problem, you can give it anyway. You can tell it. You must tell the patient so that the patient knows.
Okay.
So this version to ask you tell the patient
very quickly. And my next line of questioning is still intertwined with drug dispensing process, the role of the pharmacist, and also medication safety. We've had reports where in the line of our people that give out drugs, I mean, I'm talking about medical doctors now that prescribe these drugs. We've seen issues where due to some of them, the fact that they present with illegible handwritings, and it's affecting the prescription that they are given. You know, we have patients taking these prescriptions down to the pharmacy, and then there is the wrong drugs are being given out. Now let's look at medication safety. I'd like for you to walk us through, you know, the safety measures taken to prevent medication errors during dispensing?
Yes, thank you very much. Is a question. That's why there's a concept that we call rational drug use. The rational drug use is about the safety of the patient. Is the right drug should be to the right patient at the right dose, at the right frequency. So the drug, the pharmacist should be knowledgeable that first of all, if a prescription comes before you, first before you even start selling or preparing the drugs, you look at the name prescription and trying to verify that the person came for the drug is the right person. If it's not a person, because sometimes when hospital setting, some people run errands first. So it's your duty analysis. First of all, when you collect it from the patient after the switching the prescription, first of all, you read all the part of the prescription. The prescription is genuine. After the nudity of the prescription, you try to find out that is it a candidate for you, is it the right patient? You as knowledgeable about the drug, the right drug that is meant for this patient, especially for whereby you have the patient accelerating, you are correlating it. So when you see that it is the right patient, then you also look at the frequency. Is it the right dose and the right frequency? These are the things that pharmacists need to know to give to the patient, so the patient get the right drug, patient the right drug, the right dose, right route of administration. Also, the right store where this drug is to be taken. So now, we even talk the right disposal, because some of the drugs that are left over, people are not, the drugs are not being disposed. You need to take your drug completely, but if something that the drug cannot finish, probably, and they say there is a change in prescription, you dispose this drug. So this means that people need to know about the drugs.
Okay, now I'd like to know, how important would you say verifying a patient's information and cross-checking perhaps against allergies and drug interactions is, still talking about medication safety?
Yes, thank you very much. Drugs, we have what we call pharmacovigilance. It is a form that is supplied by NAC to everywhere where that we dispense the pharmacist collect, the hospital pharmacy, so that if there is anything that happens in the course of taking the patient, in the course of even counseling the patient, you also, people that have refused, you need to have a feedback from this patient. Maybe it tells you that after taking this drug, you have rashes. So it will be reported. The person that tells you, I will tell the person if the container touch, whatever it is, so that we collect all this information, like in a country all over Nigeria. And if they see that, okay, from KB, this social person take this drug, complaints of this, and also have this person, we have similar person from Igbo complaining of the same thing. So so when these are collated, so that action has need to be taken, we need to know that this action probably these things that is due to the drug. If it's not due to the drug, it has to go through many processes to be sure that it is really the cause this thing, and it's not part of the threat of this drug that's been documented. So when we collect all this information, because it helps in safety of other patients that will take similar. So these are the things that pharmacists are doing by filling the pharmacovigilance form, that patient get the right dose and the safety and the of these drugs.
I like the fact that with each question I ask, you have been trying to embed in between the patient education and also counseling. Now let's move away from medication safety now and go into technology in drug dispensing. I know that there are lots of pharmacists out there who are still analog. They are not really used to computing details of what they're giving out, what the information the patient is bringing in and all that. Let's look at how electronic health records and barcoding systems enhance safety and accuracy.
Yeah, thank you very much. Yes, in most of the hospital now, things are being computerized because it helps in losses of digital and accuracy of information and data. You know, in logistics, it helps because at a glance you know that it's about finishing. When you check computer, it's not like the analog that you go into count and some other things. But now, the computerized form of trying to every information is being inputted. No, even if this computer, somebody must do this information. Definitely, when dispensing drug, probably you dispense some of paracetamol, you impute it. That goes to this patient. Like in my hospital, in the NHI area of service, most of this thing has been condensed so that we know that drugs are given to this drug really went to this patient, not the drug get lost. So it helps us to see that the accountability of this is being maintained, and also because information are being imputed. This is a prescriber that prescribed this drug, and this is the pharmacist that gave us this. So everything in the computer, as someone say, as you log in, you are dispensing the drug to this special patient. If they are like, we trace back who gave this drug to who. So it helps us to very effectively, not the other time where everything is analog, you check who this also time was. But the computer, as you are logging in, the guy will show the time that you entered. So you are the one that gave the drug. If they are, we trace. So that has really helped in a lot of area of drug safety, in area of logistics. We know that we monitor our inventory more when it is being computerized.
Okay, now let us go back to, say, the role of patients. You know, we have explored the role of the pharmacist. What then would you say is the role of the patient?
The patient, many patients need to open up to the pharmacy or the drug or whoever is handling it. Because the patient, if he didn't tell you this, you wouldn't have known some things. So, just like I said, if there is adverse reaction, if the patient didn't tell you this is what I'm feeling after taking, you wouldn't know. And then also, the patient is key because the pharmacy is the last bus stop. After the dispensing of drugs, the patient is going home to take this medicine. So the we talked about is also is because if you arm the patient, also counseling, you are arming the patient that whatever you feel about this drug, you should come back and you should be able to give us a feedback so that things are being managed the way it's supposed to be. So the patient his role is very paramount in this area. If you refuse to tell you what happens, you wouldn't know what has happened in the course of taking the medication. The patient's information to give us back is very important. I remember it is antiretroviral drug in a patient, and this patient, the level has desiccant inside. So most of the other medication doesn't have desiccant. The ones I've been giving him, this particular one has desiccant. And I forgot I didn't tell the patient the desiccant inside. So the patient found the desiccant and told me that after he has finished the medication, he wanted to open this one to stay because he was thinking that maybe I found something and they added something. So I told him, no, this is just to keep up in a safe condition. It's meant for the environment of the drug. So it gives me an insight that each dispensing drug, I need to tell the patient there's a desiccant if the drug has a desiccant. So that is to say, the pharmacists need to know in the course of practice, you begin to know some other things that is information that you've got to also change, that you need to tell patients.
Okay, now let me come in very quickly. Now I'm still talking about the role of the patients. Now I'd like for you to elaborate on the importance of adhering to prescribed medications and following instructions. This is very particular for me because I know that a lot of people these days would I say have drug resistance, maybe because they are used to taking certain drugs and without completing the dosage and administration of these kind of drugs. And when they go back to these drugs, it's as if these drugs don't work for them anymore. So I'd like for you to, tell us how important it is for a patient to adhere to prescription and also taking the dosage administration very seriously.
Yes, when I was discussing the other time, just that I didn't mention that it's adherence. When I told the patient, when I shared the patient, which will have like a more understanding the pollution. It is not like the time when they give like a command to the that take drugs 8 in the morning, 8 in the now it's more of that is why it's we call it adherence. That the patient, he chooses the time for himself. The body is not like a command. You tell him that this drug is taking 8 will be taking 8 o'clock in the morning, 8 in the evening, 9 o'clock in the morning, 8 o'clock in the evening. So the patient can choose any time. Like a patient, I was giving a patient, I was supposed to take it once a day. He prefer to take it 2 a.m. He told me 2 a.m. And I told him that, why do you want to 2 a.m.? He linked drug to his activity. That is a therapy that each time around 2 a.m. he was to solve. That's why choosing 2 a.m. to take his drug. And now, so this is kind of a mutual understanding, and they had to be more on this patient because actually take it 8 o'clock. They miss those because you will forget that if he link into his activities, proper adherence to his action, we are happy that people become more adhered to drug when it's their time, when they choose what time they want to take their drugs. So adherence become more, people become more adherent. They choose drugs. I'm not talking properly. When we miss those, it leads to resistance and even tolerance.
Just before we let you go, and I'd like for you to very briefly address, the common dispensing challenges that we have, and then the way forward. What can we do to overcome these challenges?
Yeah, the common dispensing challenges we have. So the common dispensing challenges is people miss the time they're supposed to take their drugs. And we tell them that if the drug, there are some drugs that if you miss them in just 30 minutes, you can see maybe I choose 8 o'clock and it's now 8:30. You need to arm the patient that it's no more than 2 hours from the time that you choose to take your drug. Within an hour, you can still take the drug. But if it's more than 2 hours or 3 hours, then you count it as missed dose. Then we tell you that next time, please have your drugs. That's why we say link it to us so that you don't miss your dose.
Now,
you
lastly,
because we have
go as a way to wrap up the program. I'd like for us to touch very, very briefly on regulatory compliance. What's your take on regulatory compliance for pharmacists and all those dispensing medications, and also the role of government agencies in ensuring that regulatory compliance has been adhered to?
Yeah, as a government, there are things that government need to do. The supply system, it has to be adhered to. Government should make it in such a way that before fund in the hospital works very well, so that as they come to the hospital, they get their drugs and at a price. Because government a lot to see how people get the drugs. Like government is doing a lot, especially the national health insurance scheme.
Thank you so much for your time. I'm afraid that's the most we can take from you at this moment. We have been speaking with pharmacist Adamu Umar Eshimutu, who is the chairman, Pharmaceutical Society of Nigeria, Kebbi, and also the Assistant Director of Pharmaceutical Services, Federal Medical Center, Birnin, Kebbi. On that note, we've come to the end of this episode of Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow, subscribe to all of our social media platforms. Join us again on another episode of the program, Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for your time.